Welcome to Not Milk Never Milk. Subscribe if you're lactose intolerant.
You start by identifying where flexibility is limited and why. This directs the work. Begin with a 6-10-minute dynamic warm-up to increase tissue temperature and nervous system readiness. Once done, perform simple baseline tests, reach, squat depth, shoulder rotation, and mark painful ranges. Make sure to prioritize the tightest regions, such as hamstrings or thoracic spine, and allocate a focused 10-20-minute block for each area so you get measurable progress, instead of scattered stretching. You now implement a structured routine mixing active isolated moves, PNF contract relax, and loaded static holds. Each method improves different tissues and neural control. Start with active drills to build range, then use contract relax for deeper gains, and finish with loaded holds to teach control at end range. Make sure to perform 3-5 reps, 15-45-second holds, and train areas 2-4 times weekly. Also include strength at end range and eccentric control, so gains stick and injury risk drops. You finish sessions with active recovery and tracking to ensure consistent progress, record range of motion, perceived pain, and any load increases so you can adjust. Once done, respect recovery. Get sufficient sleep, hydrate, and allow 24-48 hours between intense regional work. If progress stalls despite consistent practice, deload for a week and recheck technique and posture. Make sure to consult a physical therapist if pain persists or you suspect joint or nerve involvement, so you avoid.
Thanks for watching. If this was helpful, leave a like and consider subscribing. See you next time.